Mic check, mic check, mic check.
Thank you for joining us today. General Matt Quinn, a regular fixture of our press conferences and a fan favorite, is unable to join us today. I'm pleased, though, to welcome Becky Kirschwinter with us today, who, with the Montana Department of Public Health and Human Services. Becky runs our vaccine distribution plan for the state. She's here to answer questions. Thank you for being here today, Becky. I appreciate it. I also regret that our ASL interpreters are not available to be with us today. Vicki and Macy help ensure that our press conferences are accessible to all Montanans. In their absence, and to increase accessibility, we will provide closed captions for the press conference on Facebook later today to make sure all Montanans have access to our press conference. We appreciate your patience and understanding, and we look forward to having Macy and Vicki back with us when we do our next conference. Today, I'll provide a brief update on Montana's response to COVID-19 pandemic as we approach a major milestone for the state of Montana. In January, we updated Montana's vaccine distribution plan to prioritize and protect the most vulnerable, Montanans 70 years of age and older, those with severe underlying health conditions, and Native Americans and persons of color. At that time, Montana averaged 353 new cases per day. Just a month before that, the state had averaged 546 new cases per day. Daily hospitalizations averaged 165 in the month of January, down from an daily average of 300 hospitalizations in December. And by the end of January, Montana had administered just over 100,000 vaccine doses. In February, when the state was working to vaccinate the most vulnerable in Phase 1B, Montana averaged 190 cases per day, a 46% decline in cases just between January and February. And we saw a 42% reduction in average daily hospitalizations from January to February. By the end of February, Montana had administered 255,000 doses, more than 148,000 in just 4 weeks. Our progress got even stronger in March. Over the past month, Montana averaged only 107 new cases per day, with a 43% decline from February and a 70% decline from March. This is real progress. We're also seeing an encouraging decline in hospitalizations, with an average of 55 people in the hospital this month This is a 41% decline from last month. And today, Montana has administered more than 487,000 doses to Montanans, more than 231,000 doses in the month of March alone. You've heard me say it before. Our trend lines remain encouraging, and the reason for that, these vaccines are safe and effective. They work, and I encourage Montanans to get theirs now that we're opening it up statewide. Our progress in vaccinating the most vulnerable Montanans has been impressive, and I thank all of the healthcare workers, volunteers, and others who have helped us get to this point. Tomorrow, April 1st, is a big day for Montana as we confront the virus and work to return to more normal lives. Tomorrow, every Montanan 16 years of age and older will be eligible to receive a safe and effective COVID-19 vaccine. As we've been gearing up for this expansion, we've been focused on reducing barriers to getting vaccine. We've been working on increasing access to it. To that end, I've issued a directive yesterday to make it easier for pharmacies to efficiently administer doses to more Montanans. This directive authorizes pharmacists to use licensed, qualified health providers to assist in vaccine administration during this state of emergency. It also temporarily waives a restriction on the number of pharmacy technicians a registered pharmacist may supervise for the purpose of administering doses and routine pharmacy activities. Our pharmacies have been tremendous partners in our vaccine administration effort, and I look forward to continued collaboration as all Montanans become eligible to receive the vaccine. And I encourage Montanans to receive it. Getting the vaccine will help us protect our family and friends. Getting the vaccine will help us get back to a normal life. These vaccines are saving lives, minimizing hospitalizations, and slowing the spread of the virus. We've seen that in the data. I'm pleased to announce that Montana will be seeing an uptick in our vaccine shipment this week. With roughly 15,000 doses of Pfizer, nearly 11,000 doses of Moderna, and 15,600 doses of Johnson & Johnson, Montana is slated to receive 41,610 first doses this week, in addition to the second doses we'll also be receiving. We'll also receive 25,000 second doses. This is roughly 15,000 more doses than we received just last week, and great news as we make this vaccine available to every Montanan that wants one. It's one thing for me to encourage Montanans to get the vaccine, but as Montanans, we don't just talk the talk, we walk the walk. That's why tomorrow I'll get one of these safe, effective COVID-19 vaccines right here in Lewis and Clark County. I'm glad my name has finally come up on the list, and I look forward to getting a vaccine. As we head into our Easter weekend, I want to point Montanans to some resources that they can use to learn more about the vaccine and get vaccinated in their own communities. I encourage Montanans to visit covidvaccine.mt.gov for information on vaccine availability and how to get one in your community. You can also learn more about these safe, effective vaccines by visiting the FAQ page on the website. In various communities across Montana, there may also be vaccine available through the federal retail pharmacy program at a Walgreens, CVS, Safeway, Albertsons, and Walmart, for example. To find out if there's available vaccine in your community through a retail pharmacy, you can visit vaccinefinder.org. With that, I want to conclude by encouraging Montanans to get a COVID-19 vaccine. They're safe and effective, and they work. Montanans are ready to reclaim their lives, and getting a vaccine will help us get there. And with that, I'm happy to take some questions. Do you have any questions online there, Brooke? Okay. Jonathan? Zach, excuse me, sorry.
I had a question for Becky, first of all, just about vaccine distribution in the state. Is there any rhyme or reason to which county or which city gets Moderna vaccines versus Pfizer vaccines versus Johnson & Johnson? Is there any, how does the state determine those allocations?
Right. So when we begin to look at vaccine allocations for the week, we look at the total number of the kinds and types of doses that we're going to get. And then we look at the population of the jurisdiction for which we have to do vaccines. So one thing to really consider is that the Pfizer vaccine comes in minimum dose orders of almost 1,200 doses, and also, for the most part, requires an ultra cold temperature. So those are two things that we take into consideration up front very first. So typically those doses go to our more populous counties because one, they can go through those doses quickly, and two, they have the capacity to store them. So we look at that. And then we take the allocation of Moderna, for example, and then we look at what a county should get or a jurisdiction should get, and then we fill in the gaps to make sure that everybody gets an equitable distribution. Up until about today, we haven't had enough Johnson & Johnson vaccine to really factor that in, but we'll start to begin to factor that in on a population-based, kind of what we call a pro rata allocation for the counties.
And just to follow up on that question for you, Governor, sorry, for you, Governor, there is a bill moving through the legislature regarding transgender student athletes playing sports here in Montana. This is a bill I'm sure you talked with other governors about. There are other states that are facing a similar bill, and they're also facing the potential for federal education funding to be cut out from under them. Have you had any, in conversations with the governors, with the White House, have you received any indication that this may be reality for Montana if this bill is signed?
Well, we don't want to lose funding for our athletic program. So we're watching a number of these bills. Again, I think I've signed over 100 bills so far. There are hundreds more on their way to my desk, and we're going to collect input from all the parties and make the best decision for Montana as they get to my desk. We have an online question?
Yeah, hi, Governor. This is Aaron Bolton with Montana Public Radio. I just wanted to ask if there's an overarching goal for the percentage of people in the state who wants to get vaccinated, or a percentage that is going to offer protection that the state's aiming for.
Yeah, that's a really good question. I wouldn't say we have a specific numeric target. The message we have for Montana is very clear. These vaccines are safe and effective. I'm going to get mine tomorrow, and I encourage Montanans to go out and get theirs. We are seeing increased supplies coming into the state, and again, all adults are eligible starting tomorrow. So I'd encourage you to get a shot. Holly?
Yeah, Governor, I was wondering, with President Biden earlier this week reiterating his call for states who have lifted mask mandates to put them back in place, what are your thoughts about that call, given I know you're saying vaccines are recommended in Montana, but we're also seeing variant cases increase in the state. Are there any considerations of that at all?
Well, I don't think one size fits all. I've said that from the beginning. I trust Montanans with their health and that of their loved ones. That's why we've shifted more to personal responsibility rather than what I believe are really impractical mandates and one size fits all approach. And we're seeing good results. I mean, hospitalizations are down, new infections are down. That's some of the data I shared today. Barring some reversal in the trends, we're going to continue to open up Montana so we can get back to normal. And I'm excited about tomorrow making the vaccine available to all adults in the state. Do we have a online?
Hi, yes, Governor. Casey Elliott from Dillon, Montana. Do we have any data on, or are we tracking the number of people that are refusing the vaccine percentage-wise or actual numbers-wise?
Do you want to talk a little bit about the dashboard and how we track that?
So the way that the current process has been working is we've opened up vaccine administration to those that qualify. So as we move into more of an open vaccination, we'll start to begin to look at what those trends are for people who may be not wanting to take the vaccine or more hesitant to take the vaccine. But right now it's really difficult to tell just because we've been providing services to those who want them and not necessarily those who don't. So at that time, we don't really have that information. But we do have the information on our vaccine administration, which is on our state dashboard, which can be found on our state website.
The real Jonathan.
Thank you, Governor. Yes, Jonathan Andarian, Montana Television Network. I wanted to ask, on the local level and the local health department level, do we feel that all of our counties are ready and where they need to be now as we move into this new phase? And also, I was curious if we have any indication of how long it might take to get everyone in this next phase, this phase 2, a vaccine.
So we have been surveying local municipalities on a regular basis. Becky could probably comment more specifically on that, but many municipalities are already vaccinating all adults. I don't know what you might want to add about.
So we have been in regular contact with our jurisdictions, and most, if not all of our jurisdictions that have already indicated to us that they are ready to move into vaccinating all adults as early as tomorrow. One thing to mention, though, too, is that like our other phases, vaccine won't be available in all of these jurisdictions on day one. Just because it's opening tomorrow, you may not be able to get a vaccine appointment tomorrow. But as vaccines are coming more into the state, more than we've ever seen before, we expect it to go a lot more quickly than the previous phases do. So to make a guess about how long it may take is a difficult one to do because it's really based on a lot of factors. One, how many people show up for those appointments and do get the vaccine, and we're hoping it's many. And also to how our allocations continue to increase and where those vaccines are. So that's what I would add.
Great. And we'll just take an online question if we have one.
Hi, Governor Jane Forte. This is Marisa from NBC Montana.
Hi, Marisa.
Thanks for holding this kind of 2 questions, if that's okay.
Sure.
On the first one, I know this was kind of addressed last week and you addressed it today and saying that you encourage all Montanans to get the vaccine. But I'm wondering on vaccine hesitancy, what would you say specifically to people who believe vaccines have tracking chips and change your DNA among other claims?
Well, I think we're approaching 500,000 people doses administered here in the state. These vaccines are safe and effective, and we're seeing the results. We have less hospitalizations. We have lower infection rates. I mean, dramatically since we started administering these vaccines, particularly by getting them to the most vulnerable community. So I'm signed up. I'm going to get mine tomorrow. I would encourage other Montanans to consider doing the same. This is our path back to a more normal life. And I think, Maritza, did you have a follow-on question?
Yeah, thank you so much. And I just was wondering, maybe this is more for Becky, but if there's an update on variants, and if there's any concern as we get more Montanans vaccinated, if there's concern over more mutations that would negatively affect younger people who maybe haven't been in those first years.
So I think I can take the first part of the question. As for variants, we're seeing a handful of variants across the state as they are starting to come in. But at this time, we're confident that the vaccines will cover those variants. The CDC is telling us that we're still providing good coverage for those. So of course, as we expand into the younger population, we are now working on vaccine trials for the younger population as well. So we hope to have more vaccine available into younger populations as quickly as those trials and those data become available.
And I'll just note there was an article in the Wall Street Journal today talking about some preliminary results on clinical trials with younger people 12 to 15. That's not definitive, but it was encouraging news, and we're going to keep an eye on it. Yes, please.
Hi, Aaron.
Hi, Aaron.
Thanks for having us. I understand that you're confident in the vaccine efficacy and that you'll be getting it. But I'm curious, some bills moving through the legislature concerning things like vaccine passports and stuff like that have given rise to some conversations from lawmakers, including today, making claims, for example, that vaccines cause autism or things like that, which is a statement a lawmaker made in the House today. So I'm curious if you're worried that, although your messaging is clear, that there are people in your own party or in the legislature in general who might be kind of muddying the waters.
Well, my message is clear. I'm going to get vaccinated. I also respect that people have some deeply held convictions of conscience, and each person has to make their own decision. I do know that as we've been administering these vaccines, infections have gone down, hospitalizations have gone down. We have not seen any severe complications from these vaccines, and I look forward to getting, as the English say, my jab tomorrow. Is there a question online?
Catherine with Kaiser Health News. I think that Pfizer is still the only vaccine with federal approval for 16 and 17-year-olds. I'm wondering, given that and kind of the difficulty with getting Pfizer out to some rural communities, if there's any concern about getting vaccines or vaccine access for teens.
I'll let Becky answer that.
Yeah. So this is something that we're currently working on. So we know that we know where our Pfizer vaccine is sitting in the state. And like I said earlier, it's mostly in our more populous areas. So we've already begun to plan with those areas that have the Pfizer vaccine to make vaccine available to 16 or 17-year-olds who may be out of jurisdiction, to allow them to come in and get vaccinated with some other folks. We've also asked our local jurisdictions to really start looking at the 16 and 17-year-olds in their community and who may want vaccine. And then we'll begin to plan around that. And we have some ways to get vaccines into those communities if we need to, like pack up a little a bus or something that can take the vaccine up there, we'll do that. But at this point, we're just really looking at what the need and the recommendations would be of those local health jurisdictions in places where we can't easily get the Pfizer vaccine to them. So plans are underway.
Thank you. Yes.
Governor, I just have a two-part question for you about your vaccine appointment tomorrow. I'm curious if the press, public will be able to see you get your vaccine. And then I'm also curious, we've seen other public officials around the country get their vaccine some time ago, and I'm just curious why you decided to wait till now to have your vaccine, if you thought about getting it sooner, how that conversation went.
Sure. So I'm excited about getting a vaccine. I didn't think, even though I'm the governor, I should be jumping ahead of somebody in our vulnerable population. So with opening it up to all adults, I qualify. I'll be celebrating my 60th birthday in April. So I didn't quite fall into the last classification. We will give you notice about what we're doing tomorrow and where that's going to be. So that'll be available to the press. Do we have a online?
Thank you, Governor. Aaron Bolton with Montana Public Radio again. I feel it did just kind of ask my question.
Okay.
I contributed.
Okay. Great. Holly?
Yeah, I don't know if this is best for you or Becky, kind of a two-part question. I'm wondering, I know Aaron touched a little bit on percent of vaccination goals, but sort of talk a little bit about if there's discussions within DPHHS or your administration about what herd immunity looks like in Montana, like if there are any sort of benchmarks there. And then also looking way out ahead in the future with vaccinations and understanding, I guess on initial reporting that they might last about 6 to 8 months, or what planning is in place for if there's a second round of vaccination efforts down the road.
Okay. Becky?
I guess that'll be pretty easy to answer. At this time, we don't really know. I think the CDC is still looking at vaccine efficacy as it moves into the next several months. They're still looking at, how well people are responding to the vaccine, whether we'll need new vaccines, whether we'll need a booster, things like that. But I think it's too soon to tell.
It's a good opportunity just to give a shout out to our medical community. They have done a phenomenal job. Public health officials, hospitals, volunteers. We're now administering hundreds of thousands of doses each month in the state. We've shown that we can get it done. And that gives me some confidence that if in fact the efficacy is not as much as we want it to be, we can get boosters to people that need them. So, online question?
Hi, this is James Forsyth. This is Melissa Leverage from the Oakland Daily Chronicle. I'm curious if there are any conversations going on with you and your team about vaccinating kids under the age of 16 if or when vaccines are approved for those kids, and what that rollout looks like.
Okay, well, we have to wait for the clinical trials for it to be approved for that age group, but Becky, I don't know if there's anything you want to share on that, or?
So, of course, we're keeping close watch on when and if those vaccines are approved for those age groups. And then I think, really realistically, what we would do is probably take the same approach that we've taken with the current vaccine and making it available for the jurisdictions through the health departments, through our tribal communities and others. So I don't think it would look a ton different. We might be putting it out into some more pediatric offices or things like that, but time will tell on that one too.
The real Jonathan?
Thank you. Yes, Jonathan Andarian again, MTN. I just wanted to ask briefly on a non-related subject. I saw that the Fish and Wildlife Service has determined to keep the grizzly bears threatened status after their latest review. I was curious if you had any reaction to that news.
Well, I haven't seen the final ruling. I did get news that this is U.S. Wildlife Service has made this determination. You know, based on the biologists I've spoken with, we have a recovered population. The purpose of the Endangered Species Act is very clear. It's to help threatened species recover. That has happened along most of their range here in Montana based on the biologists. I would have liked to have seen a different decision. These grizzly bears, we've seen predation increase on an annual basis, and it's unfortunate. Montana is perfectly able to manage this population if we had the control to do it. Until the delisting occurs, that's not possible. Yeah. Yes.
Hi, and switching gears slightly, I know you won't really go into too many specifics on legislation that's still making its way through the process, so sort of just a general policy. For the implementation of recreational marijuana, I'm curious if there are any restrictions that you personally think are important to be on there, whatever product is sold, whether that's like THC limits or for giving counties the option to opt out or opt in, if there's just anything that's kind of a top of your mind.
Well, as you know, Mike Hopkins, Representative Hopkins, has introduced that bill. We're watching it track through. Our concerns from the administration perspective is really the logistics of implementing the program. How do we effectively administer the licenses that need to be granted to those that would be retailing the product? How do we assure that we're collecting the revenues that are mandated by the voter initiative? So our interests are primarily in the logistics, because as the executive branch, whatever the legislature comes up with, we have to implement. So that's really where our concerns are. Online? Yeah.
Hi, yes, Governor. Cynthia again. Can you go again? One more question about that, specifically about COVID testing. You guys have given information about how that's going to go in the future. Are we still going to continue testing symptomatic people, or just anyone who wants one? How are the supplies going that?
Okay, I'm looking at Becky, and I wish I had General Quinn here today. So we'll have to get back to you on that, how we're doing. I mean, we continue to make tests available to folks. We have stockpiles on our bi-weekly, twice-a-week calls. We discuss requests from public health officials for resources, including National Guard staffing to run vaccine clinics, testing supplies, PPE, and we track that on a regular basis. So we have, in those calls, we've not discussed changing at all the way we've been doing those distributions. I would expect that we would continue to make those resources available. Holly?
Yeah, another policy, not COVID question. I'm wondering, there's two bills, one from Senator Kerry Smith, one from Representative James Gillette, that are looking at the state's Medicaid program and how people are qualified and how frequently. And I know in the campaign we talked about someone, I'm pretty sure the right people were getting coverage with those programs. I wanted to ask about the continuous eligibility component that both of those have in that. If you have any concerns with the churn that might create, or if that's something that you'd like to see implemented as part of your campaign goals.
Yeah, and again, it's a circuitous process through the legislature. There are still hundreds of bills. We're watching these things, and again, my commitment is I'm going to listen to all the stakeholders involved once we get a final bill to make a determination if I'll sign it or not. Do we have any other questions here in the room? One more online? We'll make that our last one.
Yes, Governor, this is Aaron with Montana Public Radio again. One question I did forget to ask. The CDC says immunity comes about 2 weeks after the final shot. And it's recommending that folks even fully immunized take precautions with masking, social distancing, avoiding crowds. Just wondering how, if you're being information after getting vaccinated.
Well, I think we should always be respectful of the people around us. If we had a head cold, we wouldn't be in close contact with other folks. This is no different. I think you're right. It takes a little while for the vaccine to become effective within someone's system. So it is, I'll continue to follow the CDC guidelines. Great. Thank you very much for being here today.